that, again, the information is useful and helpful to you all. I'll start off just quickly with a word of prayer, and then we'll get started. Most High Gracious Heavenly Father, we thank you again for another day, and again for the opportunity to discuss and share and to edify and learn that which we can about this current crisis and pandemic. Open our minds, open our hearts, and allow us to be permeated by the wisdom and truth that you've shared. In Jesus' name I pray, amen. Okay, so this is our seventh it's it's a high number, but time has flown by, and I hope these sessions have been very useful. We are now sort of in a more chronic state, if you will, and I say that only because it's very likely that we're going to have a protracted, sort of at least low-grade background noise of infection in our environment, particularly in our county, for a while, and I'll go through that in a second. Again, as usual, I'd like to start off by going through some trends in the data that's available to you all on the Department of Public Health website or the California website. And then, since there weren't really any submitted questions, I'll address something that kind of came up last week as a controversy and address that. Then we'll have time for just sort of open discussion. Again, just to remember this, I review this every time just in case there are new people participating. We don't know any more than what we've sort of known for the last maybe 2 months about the natural history of this disease, and particularly the notion that there's an incubation period and an asymptomatic period for which patients can become contagious and not have any symptoms or have mild or minimum symptoms. And it's because of this and this protracted state that really makes this a unique virus and contagious virus in our population, meaning that it's highly infectious and highly contagious from person to person, even when you are asymptomatic. And that can be that way for some time, not just for a few hours, a day or two, 3 or 4 like it is with the flu, but maybe even weeks. And so that's what makes this very difficult to control and identify those at risk. We know that we still only have a small fraction of the people in the United States, as well as California, and more particularly Los Angeles, who have actually been infected. We know that probably less than 10% of people have been infected, at least by our testing. And so there are still lots and lots of people who are susceptible and therefore at risk. So again, it's sort of the asymptomatic pieces to this natural history that is so important. And it's why it belies the logic and the rationale for us being extra cautious and preparing ourselves with the necessary strategies so that we aren't infected. And even if we do fine and aren't sick, that we don't actually transmit that infection to someone else. And so, again, that's something that I'd like to underscore, and I'll come back to that a little bit later on. By the numbers, just simply by the numbers, our first broadcast was April 6th. And April 6th, we had 16,323 individuals who were confirmed cases. And we've tested many more. So we nearly now, as of today, have about 100,000 cases, confirmed cases, in just over 6 weeks. And again, that can be a false number to track. It may just maybe because we have more testing available, more people are getting tested. But you can't falsely increase the number of people who've died. And the number of people who've died on April 6th cumulatively compared to now May 26th, 3 weeks later, you can see we're now looking at 10 times the number of folks that have died. When you look at the graphs itself, the new cases, those cases look like they're actually sort of going up slightly. So the curve may not be completely flat. I'll come back to that. Although it looks the deaths by day are relatively flat. And so there is some evidence, at least based on the epidemiology, the numbers that we are tracking, that this may be the case. Now, this is really important because as we open up the county and the state, if the number of deaths at all goes up, even a slight amount, we'll know objectively that this sort of opening up of the county, of the beaches, and all these other things are really too premature, and we may need to actually kind of close things back down again. When you look at sort of the curves, this is what we are all talking about. We talk about the flattening of the curves, and this is the most updated one as of today. And every county is certainly more flat. And again, flat is relative to this line, right? Flat is relative to this line. So all the curves are actually more horizontal, if you will. This is the Los Angeles County curve. And you can see it's more horizontal. As long as that stays that way, that's actually overall good news. It doesn't mean that the number of cases total is down, it just means the rate of increasing hasn't changed. And if you look at the total number of cases, remember I told you 99,000 cases in the state, nearly half of those cases are in Los Angeles County. Okay, and more than half of the deaths are in Los Angeles County. Now, where are those deaths? Half of those deaths are occurring in nursing homes or nursing home residents, skilled facilities, chronic care facilities. So that's half of the deaths that are actually occurring. And that means that this is our most high-risk population. We still have a number of deaths that are occurring in people who are younger than 65, and even a small fraction in people who are younger than 50, many of which are obese, many of which actually have chronic conditions, but there still is a small risk even for otherwise healthy individuals. So again, if you look at the daily totals, we have 1,800 new cases and we have 27 new deaths. And so this is what we really kind of want to watch, and what I actually have to watch as I'm on my public health countywide calls to know whether or not things are actually changing and whether or not we're going to foresee our hospitals being impacted. So we're sort of waiting to see. If you look at the reopening of the state, the sort of stages, there are 4 stages, if you will. We currently have plans that are ongoing for stage 2. Stage 3, which is opening of things like hair salons and barbershops, etc., with social distancing, is actually poised to occur this week in a variety of places in the state. And this is very important because it just means that we're going to have more and more people congregating. Now, stage 2 included beaches, and I forgot to show you on my bike ride this weekend. On Memorial Day, I saw a plane that was pulling a sign, and that sign said, "Gruesome Newsom, give us our freedom." Now you can imagine where this was. This was in Huntington Beach, and Huntington Beach was plagued with Huntington Beach residents on the beach, almost none at all with any mask, everyone with umbrellas and just sitting on the beach on their blankets, having a great time, completely ignoring the moving on the beach recommendation order. And that's very important because there was no reinforcement. People were just sort of doing their own thing. And that's been seen around the country in a variety of areas. So we're waiting to see what happens in the next 2 weeks or so to see if we have a resurgence of cases that are sort of increased to know whether or not our strategies or the ignorance of the ignorance of our strategies with regard to adherence to distancing, with regard to adhering to wearing masks, really will have an impact. And so we'll find out in the next 10 days to 2 weeks. And that will inform how quickly we actually spread stage 3 opening throughout the state, as well as even consider progressing to stage 4. As some of you may know, there are some states, like in South Carolina, for example, this weekend, they had a car race that was widely attended. There was no distancing requirements. There was no requirement for masks. Maybe 1 in 10 to 1 in 15 people had a mask on. They were watching stock car races, etc., just as if it was normal last year. Again, we'll see whether or not that's had an impact. I think most of us believe that there's no doubt that within a couple of weeks, we'll begin to see a surge again. So please do your part. The recommendation for sort of going from stage 2 to stage 3 and further was based on counties meeting a 14-day decrement with regard to the number of new cases. And per 100,000, you actually need to have a number of 25 cases or less per 100,000. LA County is at 136 cases per 100,000, and the goal is to be 25 or less. Of the sort of 50 some odd counties in the state, there are 38 that meet that definition. None of those are counties which are heavily populated. These are all counties which are very, very small and rural counties. Our busy counties, as you can see, all have significantly higher numbers than the 25. So we have a ways to go, and we should be really clear that we should take precaution until we see our numbers actually falling. And so far, we actually haven't seen a drop. We've actually seen either a steady number or increase, particularly in LA County. So that's it with regard to data that I have to share with you. And the one question that came up last week was, should I wear a mask or not? Some of you may recall Dr. Fauci, who's a really bright guy, who's been at the head of the CDC pandemic communication for the White House, and himself, someone who, as a scientist and epidemiologist, is very well regarded. And I believe that he is doing his utmost best to provide information and the right information to the public. Well, he was in an interview and he was quoted as saying, basically, wearing a mask doesn't really do anything. I don't know why people really need to wear a mask. And this is despite the CDC recommendations and many Department of Public Health, particularly at the county level and the state level, recommending wearing a mask. Subsequent to that, there was a report that people wearing a mask might actually even be worse off. And so I want to address that very quickly. Should you wear a mask? And the answer is yes, you should wear a mask. And the details in terms of its requirements may vary significantly depending on where you are, county, city, or state. In some cities in Los Angeles County, in some cities that are incorporated cities, you can get ticketed. So like if you're in Hollywood, for example, you could get ticketed and a fine as high as $1,000 for not wearing a mask. So I would be very careful where you are if you're going to take an attitude that's cavalier. Now that's just being careful as it relates to making sure you're not unduly or unnecessarily detained or fined monetarily for not wearing a mask. Now, from a health perspective, wearing a mask properly does protect potentially you, but definitely protects to some degree those that you are around. And what I will say is it really depends on what kind of mask you are wearing. One of my dear friends, and you all know her, Hope Smith, has been making masks and giving them away and actually even started selling them. And this isn't a commercial for her. She doesn't know I'm saying this. But I saw her this weekend and she had a bag of masks. And I put those masks to the test. They're cloth masks with double layers and a fine linen inner layer, which she made herself. And what I can tell you is that her masks are as good, but much more stylish than the surgical masks that I get from the hospital. They're excellent. And remember, the difference between a regular cloth mask that oftentimes isn't double layered is that it's quite porous, meaning that the air particles, the viral particles can go right through. So when you have a very porous cloth mask on, most of the time it does not protect you because you can inhale viral particles right through it, okay? Versus a surgical mask for which it protects you from inhaling fine particles as well as protects individuals around you from exhaling fine particles. So a surgical mask protects both you and the people you're around, and the average cloth mask protects to some degree, to a mild degree, people that you're around, but doesn't really protect you at all. Now, again, the qualifier for that is the quality of the cloth mask. Some cloth masks are made extremely well. And the best way to test that is simply to take a piece of paper and your cloth mask and put that on and blow hard through that. Okay, and I'll give you an example. I obviously don't have a mask on, but if I had a mask on, a cloth mask on, I blew through it, you would see that move. I'll give you an example of a surgical mask. Happen to have one close by. Here's a surgical mask, very thin. It's very close to the material of linen, okay? And a finely woven linen cloth mask that's double layers will work actually quite well. Okay, it's on. I'm gonna now blow. I'm blowing hard. The only movement is my hand because, you know, I'm not perfectly still, but I'm blowing as hard as I can. Nothing, okay? So I will tell you that a really good cloth mask that's made with double layers, that has particularly linen or something fine in the inner layer, will work just as good as a surgical mask and can be washed and reused as opposed to disposed of like a surgical mask. So if you have the right cloth mask, it will protect both you and the surroundings. If you have the wrong cloth mask, it really just protects the surroundings. It doesn't really protect you that much. I hope that makes sense. The current recommendation is still to wear a cloth mask when in public and in anticipation of contacting others. And as you all probably have already discovered, it's important for you to wear a cloth mask to go into many venues and stores. They may not even let you in. Again, not an advertisement for Hope Smith, but she has a phenomenal cloth mask that I think works extremely well. They're really high quality. Hope's actually quite a wonderful seamstress and actually does quilting and a variety of other things. But she's made a really nice cloth mask that fits quite well and is protective, just like a surgical mask, and can be washed. And so you could contact her if you want, or you might find something online that's very similar. But the routine cloth masks are not protective. Okay. I'm open now for whatever questions that folk may have. And at the top of the hour, I believe David asked a question about ways we could protect ourselves now that we're sort of opening things back up or having to go to access to stores, etc. And what I would say to that is the three principles are the same. We know what we know about the way this virus is spread, right? It's spread person to person by droplets and by touching surfaces which have been contaminated or infected. And so with that, wearing a mask, particularly if you wear a high quality mask, is a helpful way to protect yourself when you're outside or in contact with others. Washing your hands, 20 seconds. Jesus loves me, this I know, or happy birthday, whatever. But wash your hands thoroughly with soap and water works really well. If not, hand sanitizer. And doing that as often as you can, particularly if you're in contact with foreign surfaces which are beyond your control. Decontaminating surfaces in your home or in your workspace. These are things that you should continue to do even as we open things back up. And the other thing you can do is minimize unnecessary exposure or travel to people, particularly people who you may not know about their travel or contact or exposure. And so there's really no new news in this regard. What we have been talking about for the last several weeks about protecting yourself is still what you need to do. And what I would say is don't be tempted, even though you may see lots of people around you, taking it for granted, thinking that in fact, you know, I don't need to wear a mask. I can go out and talk to people and be right next to them and they're just seemingly not worried. Don't be lulled into complacency. Don't be lulled into buying into conspiracy theories. Protect yourself in the ways that we've described. Okay? All right, other questions that people might have.
One question somebody asked about the nursing homes, that the majority of our cases were from nursing homes. Are they doing anything to alleviate that situation?
Yeah, so it's a good question. And again, it's about half the cases in the state of California have been traced to a nursing home. And that includes nursing home residents as well as nursing home workers. As I think some of you may know, nursing homes are, for the most part, private facilities. They're not state ran. They're not public health facilities, so they're private. And as small private facilities, they are at the bottom of the list of getting PPE from vendors, meaning the people who've gotten testing available and have gotten surgical masks and other equipment necessary on order or back order have been large corporations, large research test facilities, large organizations who can make big purchases. And so large chains of nursing facilities that are maybe nationwide, et cetera, they have more purchasing power. They are more likely to have actually got the proper equipment and testing necessary to make the environment more safe. The mom and pop skilled facilities, on the other hand, are really at a disadvantage. This is no different than community hospitals. It's why you could see in New York a hospital on one side of the street, literally, with all of the testing and all the equipment that they needed, all the ventilators they needed, and on the other side of the street, struggle to get just masks for doctors, okay? And so the same thing actually exists in nursing homes, and that nursing homes are financially supported and driven and managed in unique and different ways from facility to facility. And because of that, you have such variety in the resources that an individual facility might have to protect their workers and to support the patients. So if you have a family member or someone in a skilled facility, many skilled facilities are not allowing visitors. Almost all of them haven't allowed the visitors, but you can try to inquire a little bit about their policies and about the resources that they have. And sometimes just going and looking at how the workers are going in and out of the facility and what they're wearing is actually sometimes a hint to how they're resourced. But the reason why we have such high rates in the skilled facilities, and I believe skilled facilities, is because the population is susceptible and high risk for complications on the one hand, obviously elderly, frail, but on the other hand, the resources are quite variable for them to actually have what they need to protect the healthcare workers who are bringing it in from the community, as well as the spread in the facilities, as they don't have, for example, negative pressure isolation rooms in skilled facilities, right? So just the setup itself for a skilled facility is a risk itself. Public health is aware. Public health is doing what they can to educate people to try to help them with isolation. But public health is not a resource center, meaning that they don't have a budget. Department of Public Health doesn't have a budget to budget resources for privately owned nursing homes or skilled facilities. Good question. What else? Let me make sure, just looking at my chat here.
To unmute yourself, to *6 to unmute yourself to ask your question.
Yeah, I have my chat open just in case. Yep.
Okay, so we were told, because at first they told us don't wear masks and they said wear masks, but we were told to wear the mask so it prevents you from touching your nose and your mouth. So that can also prevent you from getting COVID, correct?
Yeah, that's correct. Yeah, the mask, so let's take the mask for purposes of protecting you, right? So there are two ways that a mask can protect you. One is it can protect you just by nature of being a barrier from touching your nose and your mouth, which are two ways to take the virus in from a surface that's contaminated into your system. So if you have a mask on, naturally, it just is a barrier. Lots of people have a habit of handling their masks improperly. We went over how to, take a mask on and off, et cetera, and care for the mask the other week. But that's one way. The second is that it provides a barrier against inhalation of viral particles that are airborne even early. And again, depending on the quality of the mask may or may not protect against the airborne piece of that. So some of the masks, cloth masks, are like breathing through, you know, a handkerchief. It's actually pretty easy, right? You could blow smoke or inhale something or air right through a handkerchief, and you know, blow out a match if the match was lit right through a handkerchief. And so there are lots of ways to see if the cloth mask that you have is actually effective. And if that cloth mask is on your face and you are blowing firmly through that mask and a piece of paper or a flame on a match doesn't flicker, as an example, then you know that cloth mask is actually highly protective, not just for you touching your face, but also with regard to inhalation and exhalation. And there was a good question asked this weekend. Someone asked me, well, if you have a cloth mask that is that good, is it going to prevent you from exhaling enough so that you breathe your own carbon dioxide and sort of have pacing of that? And the answer is no. There's enough air that can pressure with these cloth masks. I don't think that I've seen a cloth mask that fits so tightly that it would actually prevent air from escaping under pressure. Okay, so good question.
Dr. Harrington?
Marty? Yeah.
Yeah. You know, and I know lately.
That's my mom, by the way.
Okay. Hey, bro. Lately, we've been hearing different spins on information that has been, I guess, bombed before. The CDC just recently said that you don't have to worry about surfaces. Of course, I'm going to use my common sense and continue to do what I've been doing, but they said that the virus is you have to worry about it being in the air. No longer are surfaces an issue. And, you know, I just, and this.
Where did you hear that?
Well, they said that it's on, I guess, the CDC guideline, and I have yet to look on it. And they were questioning one of the doctors, Dr. Osterman, I believe, or something like that.
So that's not true.
Okay.
Yeah, that's inaccurate. Yeah,
I mean,
so
because Brian Williams, he was actually okay, go ahead.
No, so if you go to the website, you're right. If you go to the cdc.gov website, they have recommendations about sort of reopening, right? And they actually have reopening recommendations for businesses. They have it for places of faith, churches reopening, all this sort of stuff. And when you open those documents, they have the same 3 pillars for every document. And one is physical distancing. And then they put a caveat: if you cannot physical distance, or if that may be in breach, wear a mask.
Mm-hmm.
And then the third is disinfecting surfaces. So hygiene, and they actually just call it hygiene. And the hygiene is for your hands and for surfaces. So they recommend cleaning surfaces. Now, I would agree that you don't need to go around, fuming hydrogen peroxide or Clorox bleach, in your house or in surfaces like some of these some of these businesses are doing per se. But the idea that you do not need to clean surfaces is a farce, not true. And the CDC does recommend that. They do recommend, for example, if you're a business that only casually clean your surfaces with just a towel or even Windex without ammonia, you're just cleaning, just kind of crude cleaning surfaces and wiping off surfaces and tables and stuff like that, that you should use a bleach-based solution and clean off or disinfect your surfaces. They still recommend that. And so they're just not, so this notion that horizontal surfaces are not an issue,
Right.
is misinformation, is definitely misinformation.
Well, I
Yeah.
mean, it was concerning, and I wondered if I had heard it wrong because it was on the Brian Williams, I guess, 11th hour, and I guess he had one of the. He was a physician, and I should go check it out myself. But when I heard it, and Brian Williams was the one that says, "Wow, I stand corrected," and I'm sure a lot of families listening to this broadcast right now, and I said, well, I'm going to have to look that one up.
I am going to, while other people are asking questions, if it will go, my website is slow. For example, I'm just gonna push on this guideline. This is the one that's related to even opening up communities of faith, right? And the document, the detailed document is this, right? And you can see here, right? So healthy hygiene, washing hands, etc., cloth face, and then
Yeah,
intensifying, clean, disinfecting, and ventilating, right?
right.
And so and it says frequently touch surfaces, etc., right? And it's very clear
Okay.
that this piece, these three pieces: face coverings, cleaning or disinfecting, and social pillars for when you up for guidance on opening up, if you will, or anything like that. It's the same. Those are the you'll see throughout the website, and that has not changed. The
Okay.
idea, there is this, which is clarification. This happened. Clarification on the way that the virus spreads. Okay, and I'm showing you this, and
Okay.
let's see, as this up, you'll see. And people are, I think, are all reading or reading too much into this clarification statement, making it sound as if it's just taking a minute for this to open up.
Okay.
Make it sound because it's been de-emphasized that you don't address it, which is not true. Okay, it's not true at all. All right, you still absolutely need to be parts of this: facial covering, hygiene or disinfection, and physical distancing. All three of those have not changed whatsoever. I
Okay.
apologize; it's taken a minute for my deal to upload here.
So maybe that's
I'll
what.
wait for it to upload while we're.
Oh. So
But
maybe that's what he
it's
could have
this
been
link that I
referring to.
just said, which is, yeah, it's a May 22nd, and it is clarification of spread.
Oh,
And what they did is they talk about everything. They talk about pets. Yes, it can spread to pets. It would be very rare for this to go from a pet to a human, but to go from a human to a pet, yes, that has occurred rarely. So they talk about that. They do talk about that and learn more and more. The majority of the cases are from human to human contact, meaning
okay.
people with prolonged contact, person to person. So they talk about that. The problem with that epidemiology, when you say person to person or prolonged exposure to another person who's infected, is that that exposure is exposure to the person and the environment, and you can't separate the two of them. Does that make sense?
That makes sense.
So there's no way, right? There's no way for me, if I go to your house, I'm exposed, that I can see you from the surroundings in your house,
Okay.
right? Etc. Right? It's just not possible. It's just I'm so sorry it didn't load, but that's the site. Again, this is it here. It's up intended to be easier to read, and again, if you look at this summarizing paragraph here, let me just show you. The primary and most important mode of transmission of COVID is through close contact from person to person. Based on data from lab studies and what we know about similar respiratory diseases, it may be possible that a person can get COVID by touching a surface or object that has the virus on it and then touching their own mouth. But this isn't thought to be the main way the virus spreads. Okay, no one's saying it's the primary mode, but that doesn't mean that it's not an important mode, right? So to disregard it or not infect or disinfect surfaces would be irresponsible and the wrong communication.
Okay,
Okay, does that make sense?
it does, it does. I think that it was just
Okay.
miscommunicated or maybe
right.
misunderstood, yeah.
Still need to all pieces.
The governor on Monday, he released his guidelines for the church. Do you think those guidelines are sufficient, or should there be extra steps over and beyond those guidelines?
Who did it? The conference?
No, the governor, the LA County, where they said
Oh,
20% of capacity or 100, whichever is greater. And they gave, they recommended one-way traffic in and out the sanctuary and, you know, the spacing.
yeah, I think the guidance, if you look at the CDC's guidance for opening up places of faith, they are general guidelines that someone still has to translate or operationalize, right? So when you say social distancing, 6 feet, well, I don't know how to operationalize that, right? When you say, cleaning surfaces and hand hygiene, well, how do you operationalize that, So what the governor did is the governor tried to operationalize it by providing a little bit more granular recommendations. But they still are crude at best, meaning that I think that our church, as a business, so to speak, we have to become even more specific about how we're going to open up. Meaning, we're going to have to tape off pews, right? We're going to have to put maybe tape or masking tape or something in a pew to let people know where they can sit if they're a family versus where they can sit if they're not related to a family. We're going to have to deal with, how people move in and out of the sanctuary so people aren't moving past each other. I think that those are just guidelines to try to get you to think about minimizing exposure and risk to each other. But there are more granular recommendations that can easily be thought of when you think about your own physical plan. So I think what Governor Newsom did was better than the CDC, but I don't think that it's enough. I think that when it comes to Normandy is going to have to sit down and think about its physical plan and think about how we're going to operationalize physical, social distancing, how we're going to actually ensure that people have enough hand hygiene. Like, is it just enough to actually have soap and water in the bathroom? The answer is no, right? So where are we going to hygiene and what are we going to take out of the sanctuary? People maybe, so hymnals, for example, should be taken out of the sanctuary, right? People shouldn't actually have hymnals in the sanctuary. Who is going to down the sanctuary and the pews, and with what solutions, and when are they going to do that? So there are details like that I think we have to be very clear about. And we will. Are we going to self-monitor? Are we going to, test people's temperatures? Are we going to ask questions of people before they come into the sanctuary? Or are we going to leave them to their own recognizance? These are more detailed, granular questions that as a congregation, we have to decide. Whether the conference does this or not, I don't know. But if the conference doesn't do that, then I think that we as a congregation can make those decisions ourselves to make sure that we provide sort of the safest possible for our right. if they don't worship in person.
Goodness.
It's a lot to think about, but in some ways it's not. If we're just, we're patient and we sit down and think about this. I work obviously, at UCLA and Harvard UCLA, and in the hospital environment, we've been doing this since the beginning. Well, I have another job that works with a biotech company, and I was on the phone last week talking to them about how we might open up the office. And it's a large office, etc. And we're just working our way through it, patient, being practical. We're not in our workforce that makes sense, that's practical, that's rational, that's doable. And I think for the workspace that we have. And so I think we have to do the same thing for the church, that we have. We'll be okay. Any other questions?
Maybe I can work this into a question, but it's more of a comment. The first being that we did entertain the beginning of that sort of discussion after our online services past Sabbath. I led a discussion talking to the members about what they would be comfortable with and some of the things that we would need to do to provide a comfort level that would facilitate them returning to the sanctuary. And some of those things did come up: one way out, one way in, sanitizer at the door, no congregating in the foyer, waiting in the parking lot until you are told by an usher to come in, et cetera. We did go through some of those things. We just have not formalized it, but we at least started that discussion. So I appreciate that remark. Just FYI, you are sort of breaking up a little bit, so I'm not sure if there's anything you can really do about that. You pretty much stay in the same position, but sometimes it gets a little difficult to hear because, you break up quite a bit, but we're getting the majority of it. And then maybe lastly, yeah, you will kind of slow down like that, and then it'll come back, and then sometimes it'll drop out altogether. My last remark was with regards to face coverings, and I appreciate you going over that because we see a lot of face coverings, even at my job, bandanas, ski masks, the gamut, but we don't necessarily see quality masks. And so I do believe that is providing a false sense of security, and it will be interesting to see what the numbers look like after the outings this last weekend. My wife and I were out in the Long Beach area near and around her birthday, and there were a number of people on a Thursday night out at the beach congregating heavily, no coverings, very few coverings, etc. And maybe the question at the end of this remark is, what will be the response if we do not see a spike as a result of sort of a more cavalier attitude that I've personally witnessed? Should there still be a reaction if it turns out that there is no spike as a result of all this activity and sort of a laissez-faire attitude from the people at large?
Yeah, so it's first off, I appreciate that the group is beginning to have the conversations about opening up. And I hope you can hear me okay, a little bit better. So
sounds fine for now. Yeah. It sort of goes in and out, but.
Okay. So I appreciate those conversations, and if I can lend any support or help, I'm happy to do so. With regard to what happens if we don't see the spike in 2 weeks or so, I think people will probably wait another 2 weeks to see if there's just a bigger delay. And if after a month you see no increase in hospitalizations or deaths related to this, then I think that will be informative about not whether or not something's working or not, but whether or not we have enough strategies in place to protect the people, right? And And if the people who are either self-informed or informed because of our system or structure are better protected from complications, then it doesn't mean that we're not seeing new cases or that there aren't new cases. It's just that the majority of those new cases, the vast majority of those new cases, are occurring in people who are susceptible for infection, but not at risk for complications. So Huntington Beach is full of a bunch of sunbathing, relatively healthy folk, right, who are out and about, surfing, walking around, running around with their dogs on the beach, et cetera, et cetera. Those are not the people who are at risk for complications. They may all get infected. We don't see them in our system if they're not enough complications or die. And so they wouldn't be caught as a statistic. So it's possible that the people who are mostly at risk and susceptible for infection and at risk for complication, that those people have either already had it and or died, and the majority of which are at risk for complications now are self-identified or in places where we're better protecting them, meaning that the education piece is working, that people are taking the safeguards to minimize it so that the elderly person isn't going to the store, but is actually having someone bring groceries to their house, right? That we actually have other systems in place to protect those people at highest risk for complications. And if that's the case, then that will inform public health that there are some things in place that are actually working, and we might, with going through stage 3 and ultimately even stage 4, right? So it's a social experiment and a health experiment of epidemic proportions that will find out very quickly the answer to what actually happens over the next 2 to 4 weeks. And I don't think that we're saying, oh, it's hocus pocus bogus. What I do think it may mean is that for susceptible people, may take enforcement, take away fines for wearing masks in public, that I think that they will probably back off to some degree on some of the stuff they're doing in public venues and all that. But they will still emphasize the importance of protecting those at highest risk for complications. Still have to wait and see what happens. It's a good question, but it's the answer.
So will that, in your opinion, if we do not see the spike, or maybe answer on both ways, if we do see a spike, what would be your opinion or your viewpoint on the mandate or the necessity for electronic tracking or monitoring of people with or without the virus? Do you see a need for that sort of thing in society?
People are trying to push for that, and there are some countries, as you may know, who are already doing that. Particularly some authoritarian governments. We're close to it ourselves, but some openly authoritarian governments are already doing that. I think it's very unlikely that we would be doing that in the U.S. For 2 reasons, for maybe 3. The first and obvious one is look at Huntington Beach. The power of the people, freedom, people want to just do what they want to do, is too strong in many places around the country. Number one. Number 2, we don't have enough testing available for it to be useful. If you really wanted to make that worthwhile, you should test the population, right? And you need a lot of tests available to test the population to then track people, right? So if you limited that to quarantining only people who are positive, it might work, but I doubt that that's going to happen, because it would mean exposing that technology to other people and forcing this idea of you must know whether you're positive or negative before you do something. And we don't even have enough testing for that right now. And I think the third reason that becomes challenging for doing that is because right now, and this is going to sound really harsh, I don't think that the massive numbers of population of the people, the majority of people who have died, are people in the large proportions of people that society cares about. This is going to sound really harsh, but remember there is a faction of our leadership who, and there are other countries that are doing this, right? Like even Sweden, where they're simply saying, you know what, we'll have a little bit of caution for some very high risk people for complications, and then we're just going to let them through, go ahead and through, and we'll see what happens. Better just go ahead and get this over with. Those who are going to die are going to die, and the other people will have immunity, and we'll move on from this, right? There are a lot of people, a lot of heads of state around the world who think that way. And you should know that in the United States, there are people who believe that way, and there are governors who believe that. So I think that that also prevents a more draconian approach to controlling this virus at any county or state level, because that goes against this sort of mindset. So I think for all three reasons, it's very unlikely that we will have that sort of tracking. If you're kind of getting at end times and the technology and the virus being used for other things, I think, and I always kind of shudder at hedging opinions, but I think that the most obvious thing that's going to likely happen will be movement towards a cashless society. A closer movement towards a cashless society may come from this virus, right? Which has its own consequences. I think that's something that will probably happen first. As you know, many places already are saying we're not going to take cash and things like that. And so I think that we'll have a step in that direction, if anything. And there's already, talk about that on the technology side that's happening. Okay. Any other thoughts, questions? Very good. So again, we will have probably a separate conversation one week just about taking care of ourselves. I just want to remind you all that the most important thing you can do is obviously is take care of yourself physically and nutritionally. That's extremely important, but most important, spiritually, caring for yourselves, staying connected is extremely important. And then staying informed. There's really not a lot of new stuff going on. And there really won't be a lot of new stuff, I'm just telling you, going on for the coming months, except for whether or not we have a new surge or not. Otherwise, from a therapeutic standpoint of view, a vaccine standpoint of view, all of that, things are going to be plus or minus status quo for the next several months. And people will be trying to make up stories to make news. But we'll really just be having this sort of background of viral infection and really waiting to see if we're going to have another surge or not. So that's really it. I think it's important to stay true to what is and to make sure that we are staying connected with each other and the source. So that's all I have. And I'm going to close out with a prayer, and then we'll see you all in 2 weeks. So bow your head. Gracious, kindly Father, and we thank thee for everyone represented this communication, on this sharing, on this discussion. We thank you for allowing me to share what I've learned, that you've given me the privilege to learn and transmit that with others. I pray that people can take on balance this information and use it to help them be more hopeful and more faithful, and to share this message of hope and faith and security. Special way that you bless each one represented on this call, that they stay centered and grounded in their faith and trust in your almighty power, that they not spend a moment wasted in fragile hopelessness or unending fear that oftentimes accompanies our worry about things that we cannot control. That is the mindset of the faithless. But the mindset of the faithful is knowing that things that we don't control, we know actually who does control them. And so we ask in a special way that you would keep us with our minds fixed on you. Go with us and keep us until we meet again, and keep us safe. Amen. All right. Thank you all very much. You guys have a blessed week, and we'll see you next time.
Thank you.
Thank you.
All right. Bye-bye.